Very stable.
The meeting of the Shreveport City Council has now been called to order. Councilman James Fleur will give the invocation, and Councilman Everson will lead us in the pledge.
Let us pray. Oh, gracious God, thank you for this day. Thank you for the rain, God. We need it so desperately. We thank you for the city and all of its employees. I thank you for the mayor and the administration as they carry out the business day-to-day operation. I pray for each councilman here. And Lord, give us wisdom and knowledge. Forgive us of our sins. Go with us and guide us and give us knowledge and wisdom. In Christ's name I pray. Amen.
Amen. Amen.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, will you call the roll, please?
Councilman Brown. Councilman Evans.
Here.
Councilman Bishop.
This is mine.
Councilman Corbin.
Present.
Councilman Floyd.
Present.
Councilwoman Lynch. And Councilman Bowman.
Here. Tomorrow, I entertain a motion to approve the minutes of the administrative conference from September 10th and September 11th. Does any council member have any awards or distinguished guests they'd like to recognize at this time? Zero. Mayor Tyler, you have any recognitions or communications?
No, sir. I do have appointments for today. If I may bring those up whenever you get to that point.
We can bring them up as the vice chair makes his way up to the
Present.
Thank you.
Would you like to proceed, ma'am?
Yes, sir. Thank you, Mr. Chairman. Mr. Chairman and members of the council, today we are going to bring up about 8 people who will be either new appointments or reappointments to our Workforce Development Board. These folks are people who work directly with our workforce development here in Shreveport. And so I have vetted each of them except one, and she is still out of the country. But we're going to bring up the others, and if you don't mind, I'm going to bring them all together instead of one by one.
Sounds good.
And so for reappointees, we're bringing up Ms. Robertson. Ms. Robertson? Is it Robertson? Is she here today? Alenia? Okay, she's not here. Okay, Mr. Ewing, will you come on up? Mr. Reginald Wells, will you come on up? Mr. Jim Shockley. Where's Mr. Shockley? There he is. Mr. Curtis Shepard. Mr. Shepard, thank you. Mr. Michael Journer. And Ms. Daphne Smallwood Smith. Okay. And I believe Ms. Jonah Hayes is on travel. And Ms. Alenia Robinson has not arrived. Okay, then. So these are the appointments we'd like to make to the Workforce Development Board, and they have some great ideas. They come from different sectors within our community. Some work with private organizations, private businesses. Others work with public organizations, and they have to meet certain criteria to be able to serve on this board. And we think we have a great group here who will help us with workforce development in Shreveport. So if you have questions, you may ask.
Any councilman have any questions for Ty?
Well, I just want to say it's a great group of people. Got to read a little bit of the resumes, and I've known Mike here since he was only 6'1", and Bob and his wife are close friends of ours as well. And I know that he has done some great work growing the company that he's with, and you know, the rest of the resumes and the people who I've met maybe more briefly have all been very impressive. And so I think this is a really good group, and appreciate the slate.
Absolutely.
I know that I have had the chance to meet, I think, everyone. Mike, I can't too tall for me to forget, so I can't bypass you. But I know several others I have had a chance to talk to and work with over the past years. I actually spent some time with Ms. Shepherd this past week with Ms. Bunny over at Job Corps. So appreciate the service that you do.
Would you like for them to just introduce themselves and they can tell you where they work? Okay. Sure. We'll start on the end. Come on up, Mr.
My name is Mike Joyner. I work for Shreveport Pipe Trades. I'm representing the union. We organize and train plumbers, pipe fitters, and welders. So I'm just trying to get the training up and get people back to work. That's our main goal.
Thank you. And of course, he's going to be replacing Mr. Lionel Frazier, and that's a 5-year appointment. As you know, these have different years because we stagger them. We don't want them all to go off at one time. All right. Thank you, Mr. Joyner. Okay, Ms.
My name is Jim Shockley. I'm the operations manager at Gordon Incorporated. I've been the president of the MMC, the Manufacturers Council, for the past 2 years, which heavily involved in workforce development. On the advisory board with Southern, BIPSI, and now BIP still. And so, proud to be able to have this chance to serve.
Thank you. All right.
My name is Reginald Wells. I work for United Parcel Service. I've worked for them for approximately 30 years now. I've held several management positions with them over the years, from inside operations to industrial engineering, and now I'm currently working with the on-road operation.
Thank you.
Good evening. I'm Daphne Smallwood-Smith. I'm the Area Director for the Shreveport region for the Department of Children and Family Service, the Economic Stability Division, and I work with families and with individuals to help them develop those skills that they'll need in order to secure employment and to and to become self-reliant.
Good afternoon. I'm Bob Ewing. I'm the president of Red Ball Oxygen. We're a local distributor of industrial gases and welding hard goods. I'm very interested in workforce development. Been involved with the board since 2015 and also with the MMC as they're on the workforce subcommittee, and just want to see more kids and adults find good paying jobs.
Good afternoon. I'm Curtis Shepard, the Center Director at the Shreveport Job Corps Center, and I'm happy to be back home after being in North Dakota and Phoenix, Arizona. I look forward to working with the board to make it happen here in Shreveport. Thank you.
Thank you so much.
Councilman Braff.
Thank you, Mr. Chairman. Gentlemen and ladies, I, again, like my other colleagues, appreciate your presence, your resumes, your interests in helping move Shreveport. I just have a couple of questions. I guess Mr. Shockley, you was on the board previously, is that right?
Mm-hmm. The reappointment.
Yeah. Which one, Shockley or Ewing?
Shockley.
Ewing was previous.
Okay, Shockley was not. You were. Okay. Can you served on the board how many years?
Was appointed in late 2015, so 2016, 2017.
Okay. Can you share with us any some of your accomplishments, the potential that we have to draw potential businesses, companies here?
Yeah, I think two initiatives that the board's been involved with recently. One is the Work Keys program, helping with work-ready communities. A lot of good communication on that issue. Establishing sector partnerships. I've been involved with the manufacturing sector partnership. That was an initiative that was launched with the board. And of course, the good work that's being done down at the Business and Career Center. I think there's always more opportunity to do coordination and get more private sector leadership and involvement. That's the challenge. And really the purpose of this board is to more effectively communicate what industry's requirements are, so that we're training folks for the right skills and the right opportunities that are actually out there in the marketplace.
Yes.
So we can always get better at that, but I think there's a lot of good work being done.
Thank you, and I appreciate those remarks. I do know, and I hope you understand, the challenges of Shreveport in regards to attracting living wage employment. we had a recent Alice report that sort of describes where we are and where we need to go. I think under the leadership of the mayor, we've been making progress, but we still have a long ways to go. Thank you for your service. Let me ask you, Michael. You say you involved with union? With the
Yes,
union?
sir. I actually run the Shreveport Pipe Trades Training Center. We train. We have a 5-year apprenticeship program for HVAC, pipe fitting, welding, and plumbing.
Okay. Well, I'd like the labor
Yes.
component into this. How do you see your role in playing on this commission?
Well, I've been a member of the union since 2000. I've worked in Shreveport since that time, and I see some of the needs. I've had apprentices come work for me on the job. I've had apprentices that I've taught in class. I also teach at the school, and I see some of the struggles they go through and some of the things they need to stay on the right track to finish what they started. And I hope to, being a member of this committee, I can help make that happen and get these apprentices to get well-paid, steady jobs, not just a job but a career.
Sure.
And something that they can move forward and provide for their families with.
And thank you for those remarks. We had opportunity to review your resumes prior to you coming here today, and each one of you have very impressive resumes, as well as your overall community involvement. So we're going to trust that you guys can add to the continued progress and future of what we're trying to get accomplished here in town. We really want to keep good people here with good paying jobs, and I think having the private sector involved would move forward. And I'm hoping that somewhere in the interim, Mayor, that they can come back maybe in 6 months and give us a review of what's going on,
We'd love to do that.
and offer whatever they feel like the council could do to assist
Absolutely.
them. We would be willing to
Absolutely.
consider that.
Okay, that'd be great. I think we have a great group. These are not all of them. We have others.
That's on the committee. I'm sorry.
Is it 20? 20 on the whole?
Yeah.
Yeah, right.
Terms and replacements. Yeah.
And they're staggered. So
Okay.
it's just time for us to put in some new ones because we had others that rolled off.
Yeah.
And then we had some that we needed to reappoint. They hadn't been on there for a couple of years, 2 or 3 years. And we needed to keep, some of them on there. So we've got about 3 that we're asking for reappointments because they hadn't been on there very long. And but we'd love to bring them back. We are excited about. We vetted each of these, and they've actually shared with me what it is that they're going to be doing going forward in terms of being innovative and looking at ways we can better develop our workforce here in Shreveport. We have, I know you know, a great business and career center. We've sent about 20,000 people through that center in the last couple of years where they go in and we do a lot of job training, job referrals. We do veteran services. We do a great job over there on Fairfield. And so I'd like for you all to go over there sometimes. But this board actually helps to pass policies for what we do over there. We get some grant funding, of course, from the state through our WEIR Act. And we're able to, I'm hoping we'll be able to do more alignment with what we're trying to do with workforce development to spend those dollars as efficiently and effectively as possible.
Great. And again, man, you understand what we hear often. I'm leaving out. There's nothing to stay around here for it. It's always sort of a negative review of Shreveport when it comes to job.
Yes, sir.
So hopefully we can change that perception and move in a very positive way.
And I think here lately, since I've been on the campaign trail more or less, more people are coming back. You don't hear that. I think it's a pride thing in Shreveport because a lot of these people are coming back to Shreveport.
Yeah, young man that came back.
Yeah, well, I've met a lot of them recently that have come back.
Sure.
We got low cost of living. We've got a lot to offer in Shreveport, and we need to, I think, develop that mindset because right now everybody is just negative about our city, and then people want a position, they just bash your city, and that's just how I feel about it. So, but I'm going to be the cheerleader, and we're going to get people back, and we are getting people back. I meet them every day.
Oh, I agree that. I think it's a balance, but again, I think that if we can show, not only from the government, but from the private sector, that we
Yes.
are interested in creating new and better jobs.
Absolutely. And
being
we're in
attractive.
conversation every month with new companies, actually. We're working on several now that are really going to be big if we can get them in here. If people quit bashing our city, we can get some more folk in here.
That's going to change.
Well,
That's all I have, Mr. Chairman. Thank you. Thank you, Mayor.
Thank you, sir. Any other questions? All right. Thank you all so much for volunteering to take on these responsibilities, and we appreciate you. We'll bring you back in about 6 months, and then you can kind of give us an update on where we are. Thank you all so much. And are we still? We don't have to bring them back. I think in the past we've not brought them back. Once we bring them up the first time, we won't bring them back. We don't have to bring them back again. That's been kind of an unwritten guideline that we've been using. Okay.
Yeah.
Thank you all so much for coming today. All right.
I think Ms. Daphne wants to come back, so we might.
Ms. Daphne want to come back? And I have one other announcement, Mr. Chairman. I want to ask us to be in prayer for William Bradford's family. His father-in-law passed away on yesterday, I believe, and so that's why he's not here today. Okay, thank you.
That was on my notes to say next. Ms. Karen came and jerked my chain. So, be in prayer for him and his wife and his family. Mr. Green, anyone has anything related to the property standards, Mr. Green? Nope. Nobody.
Mr. Chairman, I don't have anything specific, Mr. Green, but I want to thank the mayor, administration, Public Works, Mike Woods, Gary Norman, and certainly Ron Robinson, who all joined me last week up at North Shreveport Neighborhood Association. They had a lot of questions. I think you got some of those inquiries, and hopefully we can move forward. I thought it was a very positive meeting. Thank you all for participating in that.
The owner of the townhouses has been served.
Oh, really?
In Bossier City.
Okay, that's good. They're happy to hear that. Okay, and let's follow up and see how we can at least get them to address that property standard issue. Thank you, sir.
Thank you, Mr. Green. Mr. Clark, tomorrow you have a master plan committee report. Thank you. And we received a budget to financial report from Mr. Crawford. We have no public hearing. Mr. Crawford, will there be any legislation added tomorrow?
Not that the administration is aware of, Mr. Chairman.
Okay. Questions, please?
Yes. We have one, Mr. Rob Broussard on property standards report. Guess it is indeed on our agenda.
It's an item. Rob Broussard, 451 Santa for Shreveport, Louisiana. Before we get to the property standards issue, I'd like to say thank you to all of you in the City Council for the 4 years of fun, but progress that we've made. I know some of you may not think it's fun because you've been the object of our concerns, but the Mayor's office and most of you on the City Council have worked to help make Broadmoor a better place, and my term is up. I was term limited, and I do want to thank you all for that. Okay? Now, as of this moment, I speak as a private citizen. Okay, so as a private citizen, I want to say thank you to Public Works and stuff, but we're still having issues with getting the infrastructure within our own city taken care of. And it came up in an annexation issue, and I know property standards has a lot of problems that they try to deal with. And I would hope in the next term, the next year, that we pass ordinances that will enable property standards to better do their job, and that we can streamline that process, because it's that process that creates a lot of aggravation to citizens and those who are trying to make sure that their neighborhoods are clean and people don't park on the lawns, and that streets and houses and property are kept up. So for property standards, I hope that every one of y'all will push for ordinances that will streamline that process. So thank you for your time, and again, thank you for the last 4 years. Appreciate it.
Thank you.
That's all we have for public.
Thank you, sir. No items on the consent agenda. Mr. Crawford, regular agenda?
Yes, sir. Regular agenda legislation resolutions on second reading and final passage, all which will require only one reading. Resolution 111 authorizes the execution of a cooperative endeavor agreement with Louisiana Film Prize, LLC. Resolution 112 authorizes the mayor to accept a fire prevention and safety grant in the amount of $38,572 from the Federal Emergency Management Agency and the Department of Homeland Security to be utilized by the Shreveport Fire Department for the purchase of smoke detectors and literature to be distributed to the citizens of Shreveport. And then Resolution 116 authorizes the mayor to dedicate the 400 block of North Holtzman Avenue in honor of Miss Essie A. Johnson.
Okay. Councilman Bradford?
Mr. Chairman, to speak on Resolution 116, I'm asking the council to support this resolution only because of who this lady is. Miss Johnson, S. Anderson Johnson, was an icon of the Allendale community for over 40 years. She, if you're from Allendale, you would know her. She passed away in 2006, but her legacy lives on. Part of the resolution states just a tidbit of her work. She served, Amesau Elementary School is on Holtzman. She served the PTA there as well as the Scout den mother for over 25 years. She assisted in so many areas. Her and her husband started the Passion Civic Club. Again, one of the pillars of the Allendale community. If you, again, lived in Allendale, you would be familiar with the Passion Civic Club, where they did so many things to help improve not only Allendale, but but provide wholesome activities for young people as well. So I'm asking that you would support me on this. And the reason I know so much about this lady is because I married her daughter. And
So there'll be a friendly reminder if you don't get it passed. Is that kind of where you're going with that?
It's all on her marriage. All on her marriage. Thank you, Mr. Chairman.
Yes, sir.
You know, I'm glad you mentioned a little bit about Miss Johnson. I have a constituent also named Essie Johnson, and I was like, wait, is this? I mean, she's still around when you said that. But it just happens to be a coincidence. But the Essie Johnson in my district is also very active and is a frequent reporter of things that need to be reported, and I appreciate her. So, must be a good name.
All right. Mr. Crawford, would you proceed?
Yes, sir, Mr. Chairman. We're under introduction of resolutions not to be adopted.
Crawford?
Okay, Ms.
I
Crawford.
need you
Yes.
to get up on my board.
Okay, well,
I'm
I
sorry.
did click it, but you went back.
Not on.
So, I do notice we have Gregory Kallenberg here. I believe he was going to make a presentation or something at the request of the administration, or are we going to do that later?
We did not invite him to make a presentation. We just asked him to be here just in case there were any questions.
Questions about the agenda
Yes,
item.
yes,
Okay,
he-
sorry, my confusion. Okay,
Thank you.
That's why you didn't press the button. Mr. Crawford,
Are we good?
we're good now.
All right. Introduction of resolutions not to be adopted prior to October the 9th, 2018. Resolution 113 is a resolution authorizing the Shreveport Airport Authority to execute a permanent right-of-way and easement with Southwest Electric Power Company. This is going to allow the relocation of power lines to be underground to accommodate runway extensions at the Shreveport Regional Airport. Resolution 114 authorizes the mayor to execute an acceptance of act of donation between the City of Shreveport and Black and Nelson LLC, hereinafter called owner and acting herein through Jed Blackburn, for the water main extension and related facilities to serve Industrial Loop Business Park Unit 3 and Unit 4. This is on Burt Coons, just west of Wallace Lake near the Taco Bueno. Resolution 115 accepting a donation from Shreveport Green and the Querbees Park Foundation. This is for $25,000 to provide improvements and upgrades to Querbees Park Golf Course for tee renovations and landscaping.
All right. No questions?
Let me ask, on the 115, the donation is from them to us or from us to them?
We don't donate.
They're
They're donating $25,000 to us
to provide the services that
for the tee renovation and for some landscaping at Querbees Park.
Okay.
Yes, sir.
I'm good.
Okay. Mr. Crawford?
Let's not turn it down.
Yeah, no. Introduction of ordinances not to be adopted prior to October the 9th, 2018. Ordinance 77 amends the 2018 capital improvements budget. This is to purchase a foreign object and debris remover for Shreveport Downtown Airport. It's $5,510. The funds are being provided by Louisiana Department of Transportation. 78 is the same thing. They're providing the same type of machine for the Shreveport Regional Airport at a cost of $11,020. Again, the funds are coming from Louisiana Department of Transportation in both 77 and 78. Ordinance 79, notifying Union Pacific and other interested parties that the city engineer and director of public works through the office of the mayor are authorized to begin the process to reopen vehicular access to Lake Street from Commerce Street to Skyport Discovery Center, including reopening vehicular access to cross over the Lake Street Railroad grade crossing and as specified herein. Resolution 80 is to repeal and replace Chapter 36 of the City of Shreveport, Louisiana Code of Ordinances relative to the Historic Preservation Commission, and Ordinance 81 adding Article 6, Needle Exchange Program, to Chapter 50, Miscellaneous Offenses of the City of Shreveport, Louisiana Code of Ordinances relative to the authorization of a needle exchange program.
Councilman Everson?
Thank you, thank you. I've got a few things here, and I know I was able to get in touch with a few of the council members today to see if anybody had questions, but I want to run through them real quick, and then certainly expect that we will have time to answer these questions. These are just introduction today. There's no immediate time pressing on these other than, we want to get them out there and make sure people have enough time to kind of digest what's going on here. The first one is Ordinance 79. This is in relation to Lake Street. We have had kind of an ongoing project to try to put a crossing arm on the Lake Street Railroad crossing. Despite the some good efforts to keep that project moving along on track, we continue to get some slowdowns. So we thought this would be a way to kind of the citizens who've been inconvenienced by it, they also want a crossing arm if it can be done, but we need to kind of put a hard deadline on it and kind of let the railroad know, that we need them to kind of get in gear a little bit and catch up with the project. So that's the intent of that. Ordinance number 80 is...
Mr. Everson, before you move forward to 80, because I have questions from both.
Yeah.
The hotel, the Holiday Inn, they also a principal in this.
They'll be notified as well.
Okay.
So that's part of what we're doing here. Is essentially the original ordinance said that if this project wasn't done by, it was a January 2016 or something?
2017, I believe.
January 2017. So it said that we would reopen it by January 2017. Of course, we were making progress, so we delayed the reopening of it because we were hoping that progress would, that it would be completed. And so this is, we technically have the right to reopen it any day, but what we're doing here is kind of, just kind of posting a knowledge, setting a time frame, inviting everyone to stay at the table to get this project done. I think we all still want the project to be completed. I know I certainly do. But we just can't let it hang on, indefinitely.
Absolutely.
So I think what this is meant to do is kind of set a little bit of a time frame to encourage the cooperation of all parties to make sure that it gets done on time.
Yeah, I agree. And I know this was voted on and passed prior to this council, so we're talking 4 years now at least. Mm-hmm. And the interest of the hotel was one of my concerns, that they didn't want those residents to be woken up. Those tenants to be woken up in the middle of the night with the horn blowing. So if they don't provide the proper alternative, then the horn is going to start blowing again, I guess.
Mm-hmm. Correct. And so, that would happen. And so, that's why what we really want. And here's the reason that my interpretation. Now, I don't mean to speak for them. I just, what I think is kind of going on here is that the railroad, now that we've got it temporarily closed, they've got what they need.
Yeah.
Their liability is off the hook now because it's closed. So they don't have anything to motivate them to kind of hurry up a little bit. But we have the inconvenience of having a street block that is a primary access point to a lot of businesses. And so So that's why we're coming up with this, to kind of try to encourage some action from the railroad side, and try to get this completed. So that's kind of where we're coming from on it. And I appreciate those questions, and we certainly don't want anyone to think that we don't still want the same thing. We do. We just want everybody to be on the same page of getting there quickly.
Exactly.
May I?
Yes.
Actually, when we talked about this ordinance, the city has put aside the funding, and the hotel, as I understand, has done the same.
Mm-hmm.
And if Union Pacific would just put the arm, install the arm, then we're ready to go. So we're going to make a call to somebody at Union Pacific. I met with somebody 2 years ago that was an executive from that railroad company, and I plan to make a call. And I don't know if there's some kind of legal something that we can do to facilitate the process, but I will call and ask if they will go ahead and put it in.
Certainly would appreciate that.
Okay.
I think it has been one of those things where we've had a couple different staff members, that have,
Yes.
from your administration, that have made contact with them.
Yes.
And they'll respond, but then their follow-up response seems to, I just don't think it's maybe their top priority.
Okay.
But hopefully we can get them to prioritize it a little bit. This was my idea of how to do that, but I'm certainly open to any solutions. I think, again, we're all best off to see this project completed, and I think we all want to see that done. I just would feel bad leaving council without knowing that there was some degree of immediacy to it. So I know that we can find a solution here, and hope that this is part of it. And then ordinance number 80, what that is in 2012 we passed a creation of a Historic Preservation Commission, and what we did is under that, the Historic Preservation Commission had all these responsibilities and requirements. They were established to oversee, and they have met, formed, and accomplished a great deal. But some of the aspects of that office, we realized, really fit better under the Unified Development Code. They are land use determinations. They are things that in the master plan, it recommends having them in a Unified Development Code or having them as part of a one-stop shop type of process. And I believe it will be a lot more efficient way for the applicants to have their applications reviewed, processed, and get the feedback so that they can move forward. So that is the sort of beginning stage. There'll be a second phase to this. We have met with the HPC, we have met with the MPC, and there'll be a public hearing as well. So this is something we want to make sure it's clear to everybody, but it would set up in the Unified Development Code, it would add what's called Historic Preservation Overlay Districts, which HPOD for short, and these are things that would help to regulate essentially just the basic things. What you want to see is something that would protect something that is really out of place from being built there, but you don't want to prevent development from naturally taking course. It would just be things like the size of a building, the distance of the building from the street, those kind of things, the kind of basic things. It's not getting into, it's not trying to make new buildings look like old ones. It's just trying to make sure that they don't, stick out like a sore thumb. So that's sort of how some of that is organized. And then Ordinance 81 is something that the state passed a law last year allowing for this. New Orleans and Baton Rouge have already adopted ordinances. As anybody who has kind of attended neighborhood cleanups or spent a lot of time kind of picking up trash in our communities might know, in recent years you see more needles around, and it's not very safe. There are, increases in needle drug use throughout the country, and many communities have turned to needle exchange programs when done right. They are a big benefit to the public health, and we do have an organization here, the Philadelphia Center, who has an expertise in the matter. They presented some information to us a few months back about some of the dangerous numbers that we have locally with regard to the transmission of a number of transmittable diseases in our area. And this is meant to kind of help facilitate their program. And I've invited Chip from the Philadelphia Center to be here and give us a little overview. And if it's okay at this time, I'd like to invite him up. By the way, we in crafting this, this is something that we did work with the police department, the district attorney's office, obviously the Philadelphia Center, and looked at cities across both Louisiana and the country to see kind of what they were doing and make sure that we could pull best practices. This isn't something kind of brand new. This is something that is now had a test in a lot of different markets so that we could see kind of what would suit us well here. Chip, thank you.
Mayor, Chairman, members of the council, thank you for having me. My name is Chip Akins, and I am the advocacy coordinator at the Philadelphia Center, which was established in 1990 here in Shreveport to address the HIV pandemic. Since that time, this was last year, there was a bill that was not signed by the governor, which caused some confusion, offering statewide needle exchanges. What he did was go back. They had to go back, and what they've done is they've allowed each principality or each local city council to make their own decision as to whether or not they would enact a syringe program, but it would be legal under those circumstances. I always come and bring, unfortunately, the seedier side or the darker side of what goes on, but I've seen a lot of it, and it is happening here in Shreveport as much as we would like to think it's not, and I don't think that ignoring it is going to help us any. It's only going to make our numbers worse. What the syringe exchange program is really for is for harm reduction, and this is not just for the IV drug user. This is harm reduction for the entire community. Excuse me. And I'll give some examples. What we're ultimately looking for this program to do is for us to gain trust of IV drug users and have them come into our facility to exchange and get clean needles and the things that they need in order not to become infected with an HIV or hepatitis C or pass it along to someone else by using dirty needles. We want to get the dirty needles off the street and exchange them with clean ones. That's the goal. And it also gives us a face-to-face with these people that we would not ordinarily have. And so once we've gained their trust, we want to get them into treatment. That's our main goal, is to get them off of drugs into treatment, and at the very least get tested for HIV, for Hep C, for all those things that are communicable through IV drug use and through sex. So that's the main goal. We will have we have a separate facility, an office within our office that is accessible from the street, and they never come into our lobby. That's where we're going to set this program up. We do have security cameras, and we are not going to disable any of those. Of course, we will keep those up, but we're not looking for any issues as far as that goes. One of the things, too, that this program does, and this is on the harm reduction side, is it reduces needle stick injuries. And this is something that Jeff had alluded to earlier. We did a survey of some people that are here at the methadone clinic and what they did to dispose of their needles. And honestly, one of the responses was they simply throw them in the trash. The other was they throw them out the window, the side of the road. We got a response from someone who said they bent the needle and then flushed it down the toilet. So these were the people that were actually drug users that are in drug treatment. We wanted to know the honest answers. And so, of course, that's some of the responses we got. We found needles in our own parking lot, and we're located in Highland. And so we've seen it there. What we really don't want to see are to see these things starting to turn up in parks where children are playing. We see dangers there, and so this is part of that. If nationwide, the numbers I'm going to give you are all from the CDC, but the reduce in needle stick injuries, 1 in 3 of first responders, and this is nationwide, over their career will experience a needle stick. So that in itself is dangerous enough, and I'm including in that policemen, I'm including firefighters, ambulance, EMTs. So that's that's another reason. We want to reduce overdose deaths. In 2015, we had 3,600 HIV diagnoses among IV drug users, and 1 in 3 age 18 to 30 now have hepatitis C. So this is a problem that's not, unfortunately, going away. We do think that the SSPs will save healthcare dollars as well. The cost of treating one person with HIV over their lifetime is almost $500,000 now. It's at $400,000. It has been proven, and this is across the country where these programs have been enacted, that SSPs do not increase drug use or crime in these communities. IV drug users are 5 times more likely to enter into treatment where one of these syringe programs is in place. Safe disposal of used needles, of course, is another one. Linkage to care, which I mentioned earlier, and testing for HIV and STIs. Access to condoms and educational materials, we would certainly have. We're looking at this also from our transgender community. We have a lot of transgender in Shreveport, transgender community, and they use a lot of needles to inject hormones, etc. So we're looking at that as well, because when you're looking at transgendered individuals, a lot of their income comes from sex work.
Comes from what?
From sex work.
Sex work.
Right, they're sex workers for the most part because they can't find a job anywhere else usually for the most part. And that there's just one window that's open as a window of opportunity to spread the virus, whether it be HIV or it be syphilis, whatever the case may be. So especially, or hepatitis C for that matter. So we're trying to close the window and make it safer, not just for the IV drug user, but also for the general public. Does that kind of get a little bit enough for you?
Could you restate? I know you mentioned it in your presentation just now, but the studies that have been done that show that the needle exchange programs don't increase drug use or crime in the communities where they're.
That's one of the biggest arguments that, especially in the beginning, that came out was that we were promoting drug use. This program was promoting drug use and increasing drug use. And there have been no studies across the country where these syringe programs have been in place that it's shown to do that. So there's no evidence that that's true. There have been, in New Orleans and Baton Rouge, for example, they started their syringe program, I know in Baton Rouge, right after the governor signed I believe it was last June, when he signed that into law, they began their program. But they have not seen any increase in crime or any increase in drug use. It just simply doesn't happen. We're just offering them a safer avenue. If they're going to use drugs anyway, let's at least make it safe for them and for the general public as much as we can. And it certainly would not involve. We need the cooperation of the police and the sheriff's department, but we certainly don't want anything involving actual drugs. Say, for example, those people are off our radar. We don't deal with that. We want them to be safe as possible, and if they're caught with drugs, they're going to jail. If they have clean syringes for us wrapped up that in our packaging that are caps on them, they're okay. That would be allowable. In addition to that, we're also going to be giving them lessons in how to properly dispose of needles and giving them the containers to do so. And they would be bringing those containers back into us and getting new ones.
So I know it's a subject that probably isn't on the forefront of a lot of our minds, but it is a public health risk that, I have legitimately seen in my district, and I know that it is a rising, risk. It's obviously something that, we're not all that familiar with. I've been working with them for a few months now on this and have learned a lot about it. But we want to put it out there and give some time for a little public discussion, let people kind of digest it. But it is something that we think, would really benefit the public health locally. It has done so in the other markets where it is. And then what was the other question that I was going to ask one more question. I'm sure it'll come to me at some point. But anyway, thank you for presenting that. And does anybody else have any initial questions? Or
I have Councilman Fleury.
Mr. Atkins. I first want to compliment
Councilman Everson, bringing you today with the information that you have. I just want to ask a few questions.
Okay.
First of all, I don't believe Shreveport's ready for this. This is going to be a hot button issue. It's already, as of 11 o'clock this morning, become, but like Jeff says, it needs discussion. I'm interested in the number of users in Shreveport, and I certainly want the fire chief to respond as to what he's seeing in the EMS that we fund out in actual on the streets of Shreveport. I want to know not necessarily what nationwide, but I want to know what's going on in Shreveport.
Right.
And so I would like to have. You said the survey on methadone. That was interesting. That folks say they're throwing them out the window, so dispose. So that's people need to hear that. I certainly would have to concede that possible health care costs would perhaps that would be we would certainly hope that it would drive that cost down. As far as increase in drug use, that's all I've heard today on the telephone is that we're condoning drug use. So I know Jeff stated that. There are no actual studies that we really can point to right now, as you pointed out. So I'm hoping that maybe that we could postpone this to discuss it in one of our committees. I'm certainly understand the need, but I'd like to hear from the fire chief as to what he's seeing on calls out there on the city. I want to hear it from him firsthand because he's the one charged for the city to keep up with ambulance and EMS. So he would be the one that would know. But I thank you for coming today. You've been very helpful. And
I can give you one figure, but that's the only one I can give you honestly, and that's the figure through our center.
Yeah.
And out of our clients, we've so far seen 26 that have eventually admitted to IV drug use. So that's the one number I can give you. And I would
if you could
think
share that with me through an email or something.
Sure.
Could you do that? Is that possible?
Sure.
Okay.
Absolutely.
Okay.
Jeff, at some point, could we listen to hear from Fire Chief on that, please?
Sure. Councilman Corbin. I'm sorry, Councilman Bradford. Skip.
You, Councilman Corbin.
No, you're on first. I'm sorry.
No, I mean, I'm really, let me just say that being in health, in the health profession, I'm very always open and curious of health and safety issues. And you're categorizing this as a health and safety issue. And that the issue or the problem unaddressed will continue to grow. But in your statistics that you mentioned, 26, that would be categorized as what, minimum, average? What do you think?
I don't think that's. I think that's a low number.
That's a low
I think that's just the number that we've gotten from people that are willing to admit it at this point, and I think that's because of the trust they've been coming into us for a while. I would not say that would certainly, but by any means, would be all of the IV drug users in Shreveport by any means,
and I'm not,
or that even come in to see us.
And excuse me for my ignorance of IV drug users. I'm not too familiar with drug users at all, to be honest with you. So where do they get their needles from at this current time?
That's a good question. They do sometimes. They're able to finagle them from relatives. A lot of times they'll get from diabetic relatives that have diabetes. They'll get some. They'll find ways to get the needles. They can't go buy them obviously, but they do. They find their ways to get a hold of them. And a lot of times I hate to think that they would be able to get a hold of them through a hazardous situation, but what they do get needles, they hold on to them because they're hard to get.
Are they?
Well, yeah, they're not easy to get, but they do hold on to them, and that means they reuse them. Okay. And the more they reuse them and the more they get passed around, the worse it becomes.
And then once they can't use them anymore, they toss them out into the public and they part of the debris and residue of the city. Yeah.
Right. That's another part of the danger. Yeah.
So the service that you would be providing as the Philadelphia Center would be, they bring in dirty needles, and you would replenish them with a clean needle.
Correct.
Where would that come from?
We would be buying those. We
would buy those
purchase
and give them to them
yes.
for free?
Yes. Yes. The sharps containers, everything would be done for free. We would, after this, if this passes, we would go to, there are several organizations that offer grants, and we would be applying for a grant after this was approved, and that would pay for all of the expenses as far as running it. It's not going to be an inexpensive proposition for us, but we will have
Are you prepared
for
to make the necessary grant writing and put together
Absolutely.
the proper apparatus?
Yeah, it's all together, ready to go. We've got to, of course, wait. We can't put the cart before the horse, of course.
Yeah.
But yeah, we certainly would be footing the expense for that. Yeah.
And again, I'm going to inquire with some internal people regarding this issue as it relates to how it is now, what the potential is. But let me ask you this: you said that you feel they can't just go ahead and purchase this needle product.
Not without a prescription, no.
Okay. How do you categorize drug users? There's just not one profile that you can give me. A lot of people do it.
Mm-hmm. And they do it for different reasons, and there are a lot of different drugs. Like I said, for example, for transgender individuals, they do it for hormones. They inject hormones with them, and they pass them around. They use them that way. There are people who use it for their heroin addicts. We have different drugs that people take with the needles, yes. It's assorted.
I'm not going to be that naive not to believe that there's not a black market for needles. Okay.
I'm sure there is.
Okay.
Yeah.
So who are we dealing with? If we're dealing with people that reusing needles, are we dealing with the poor of the poor? So how?
It ranges, but yeah, a lot of them are. We deal with a lot of homeless people. There's a big problem with injection drug use among the homeless. So we have an issue there as well. Yeah. Because these people aren't readily identifiable, nor do they want to be identified. They want to stay under the radar. So that's where our implementing this program and making sure that it's safe, they feel safe coming in to us, we're able to hopefully have them in for a few minutes, give them what they're wanting, but there's no strings attached, but there also is a lot of education involved while they're in there. And that's where we're hoping to see some progress in making headway in getting these people off of drugs, and at least, if not getting them off of drugs, at least getting them tested to make sure they're clean now of any infectious diseases. And if they are tested positive, getting them into treatment. Now, we can cure Hep C. Now, you can reacquire Hep C, but we can cure it. It's expensive, but it can be done. Yeah. HIV, we've got medicine now that can prevent it. We can't cure it, but we can prevent it from being passed on. So there are ways of slowing down the epidemic, and this is one of those ways.
And you mentioned trust, and my last question sort of is, now I'm familiar with the Philadelphia Center. I mean, you do great work. I mean, you always have a base of clients that trust you. Mm-hmm. Are some of these your clients, or this is a new market of people?
Well, the 26 that I named earlier are clients, are current clients. Okay. We do have more people that are inquiring with and I wish our wellness coordinator was here. He deals with them firsthand, I don't. But he gets phone calls a lot inquiring about needles and needle exchange. So he's been getting more inquiries lately. But I don't know because it hasn't had a chance to get out to the public yet, really, I don't think, except for where he was speaking of maybe in his district. But I don't think a lot of people are aware that we're looking into this seriously. I mean, I don't think our clientele is aware of it. So it's not something that's going to be advertised. It's going to be a word of mouth. That's really the only way you can do this is word of mouth. And the trust factor comes in when they know they're able to come into us, not be hassled, not have to worry about being recorded or turned over to the police, or that we're keeping files on them. They're able to feel safe and come in and get what they need and go. No judgment. We don't make judgment calls because that's where we're trying to develop that trust. And it does work. It has worked.
I mean,
it doesn't work with everybody, of course. There's no one answer for everything. It's not going to completely eliminate it, but we want to try.
I know you have a reputation, but at the same time, I'm wondering, this is my last question, is that if you engage this needle exchange program, and they come in without an exchange, will you give them a needle?
Yes.
You will. Okay.
Yes.
Thank you.
We don't like to, but yeah, we would do that because we would be looking at the harm factor and trying to get them into the program.
So then that would be an outlet for clean needles anyway.
Yeah, and the methadone clinic, I can't think of the name of it. It's got the health rehabilitation.
Center for Behavioral Health.
Thank you. Yeah. Yes, they're also wanting to work with us with their work together with us on this. So that's another element that I forgot to bring up.
Okay. Thank you, Mr. Chairman.
Mm-hmm.
Thank you. Councilman Corbin.
Thank you, Mr. Chairman. And Chip, thank you for bringing this information to us. Certainly, this is going to be maybe a controversial piece of legislation. Understand that, but we also have to look at both sides of it. And while a program like this may not affect the masses, it is still important. And there's plenty of time to talk about it. Make sure that we've done what we need to do.
Sure.
But if we're helping one or two people and we're eliminating some problems, then maybe that is a good thing. Councilman Everson and I appreciate Councilman Everson for calling earlier today to give me some background on this. And I know y'all, as my fellow council members, get tired of hearing run-in stories, but I will say, as somebody who runs all over the city in various neighborhoods, that along with disposable teeth flossers, hair extensions, probably number 3 are needles and syringes that you see on the street, and it really doesn't matter what neighborhood you're in.
Yeah.
So I think it's something that we need to talk about some more, make sure we vetted it out, and hopefully take action on it soon.
Agreed.
Councilman Jenkins.
So just so we're clear, this ordinance that we're enacting is allowing a needle exchange program. It's not necessarily referencing Philadelphia Center at all, i.e., it's just changing an internal policy in the city of Shreveport to allow this state law to be applicable to us.
Correct.
So that is at least that's how I understand it, because we've kind of gotten a little bit off, well, should this be something we're endorsing or not? But in reality, it says state law that we would be
accepting.
Okay, but I have to say that I am one, when I first saw it on the agenda today, it was a little bit of, yes, I would wanted to keep my head in the sand, so to speak. Because, yes, in my daily life, I don't see this as a significant issue. However, on the other hand, I do, to a certain extent, I struggle to find what the risk is by adopting this. Somebody would have to show me some significant statistics that are out there that show that needle exchanges lead to more intravenous drug use. And if that's out there, I would welcome any data along that line, because I certainly have not seen it. Yeah, I'd like to believe we don't need it in our city, but I guess the argument is, what is the harm in the sense of having it in the city, unless somebody can explain where the risk is for us. And I think that, from my perspective, is where the level of us as legislators need to be on this. Whether we agree with people that are doing it or not is a little bit immaterial on where I believe this ordinance is coming from. But that's trying to stay at a legislative level.
And I appreciate those comments, and certainly, one of the things I want to make sure, and that's why I put in a few phone calls and have this on the agenda today. There's no pressing reason to have to pass this right now, but it is obviously a conversation that takes a minute. You want people to be able to do their homework and feel comfortable with what they're voting on. So we want to put it out there, but I'm very much open to the idea of, sending this to a committee for a little bit further review. There are a lot of ways we can direct the public conversation to make sure that people have their questions answered, that we understand what we're talking about here. So we certainly want to be able to do that, and don't want anybody to feel like there's some kind of a immediate need to get this done tomorrow or anything, but it is a conversation that has a place in our public health discussion. And when you look, again, it is the type of subject that's not always that fun to think of. But when you look at the list of organizations that endorse programs like this, it includes the American Medical Association, the National Academy of Sciences, the American Public Health Association, National Institute of Health, Centers for Disease Control and Prevention, the American Bar Association, the United States Conference of Mayors, the American Nurses Association, the American Pharmaceutical Association. I mean, the list goes on. These are programs that have been pretty well vetted in their effectiveness. So, but again, there can be improvements made to this. There can be protections put in place. I mean, this is not a deal that needs to be forced through without proper discussion, but certainly do want to start that discussion. So appreciate Chip for his advocacy, and really the city attorney's office has done some good homework on this issue as well. I want to thank them, and look forward to hopefully being able to introduce this, but very willing to go ahead and also immediately recommend that be moved to a committee for further review and discussion.
Are you thinking Public Safety Committee? Did you mention that? Or?
I mean, it maybe, but I feel like there could be a better fit somewhere.
Okay. I just didn't know what you had. That's all.
I think, and Grant, I want to commend you because I thought it was a very wise and proactive measure to look at this. If it's a trend that's on the rise, we need to be prepared to deal with it at the time. But I want to be clear. Councilman Jenkins said the Philadelphia Center was not necessarily the entity that would be administrating this. But who else would be administrating this?
Well, they would be the people who are administering it, but the way our law would write is essentially it would allow for the state law to function. They would really be the only program that had met the other requirements of the state law that would be able to function. So, but again, I am absolutely open to being more specific in our local legislation.
The way it reads is apparently a hospital could do the same
as well.
Correct.
Mm-hmm.
Yeah.
It's not limited just to
But I mean, we're dealing with that sector of the community that would not be going to the hospital. Is that right?
We see a lot of intersection with what we already do.
Yeah,
so
that's what I'm saying.
Therefore,
So,
we're wanting to get.
I mean, even now, those that go to the hospitals, see their doctor and get a prescription, they're gonna get a needle anyway, right? I mean,
Councilman Bradford, was you kind of thinking? I could see your look on your face. Was you kind of thinking maybe like the EMS of the fire department? Is that what?
Well, I don't know, but
I don't know that we need this an in-house program. Let's make sure that we're clear on the fact that.
No, but your concern, Councilman Flory, was that it was sending the wrong message.
I withdraw.
No, I'm just saying you was thinking initially that by us adopting such a measure that it would send a message that we are inviting.
Yeah, but I think it's been clear here from Jeff and Mr. Atkins that that's not what.
Yeah, but I think it's
he's cleared it up.
Yeah, and even
it does need to be discussed.
No, I'm saying now I don't even know with the public hearing. Do we really need to vet it through a committee?
I mean, that's what's kind of my point. But
is it?
Well, we'll certainly have those discussions. I simply want to make sure that we have this appropriately introduced, that we have time to have the public conversation.
I want the public hearing.
Well, and the other idea is really, since there are some of us who have kind of already been talking about this a little bit, and since there are some city departments who are maybe more knowledgeable about this subject, it may be the best idea to maybe appoint a little special committee that's just kind of for this, So that could be a good way to have that conversation in a public setting with people who are subject matter experts.
Excellent idea.
Good. So you're saying New Orleans, who else has already implemented this program?
In Louisiana, it's New Orleans and Baton Rouge that I'm aware of. Now, there is another town that does it under the radar that hasn't properly vetted it through their city council, who does do a program, and I think New Orleans started out that way. They did it illegally, but they did it. But we decided we were not going to do that way here. We were going to go through the proper channels. So we would be the third program in New Orleans, I mean, in Louisiana, that I'm aware of. Yeah.
And you ever come familiar with how they've been implemented and how it's been followed?
In fact, I believe Diane, I can't think of Diane's last name, Assistant City Attorney, is that correct?
Danielle Farr.
Yeah, I believe she took those two ordinances from New Orleans and Baton Rouge, and that's how she wrote the ordinance for here.
Ours
if I'm
is a
not
little
mistaken.
closer to Baton Rouge. New Orleans anticipates the need for multiple programs, and
Right.
we don't think that we have the demand for multiple programs.
Right.
So there's no, the state, as far as the state ordinances or laws, they already been passed those. We don't need to suspend.
Correct. Yeah.
Right.
The state's passed, and then the way the state reads is it leaves it up to the local to. We would have the local laws have to adopt something like this in order to allow the state to stay.
Should become law in the state.
Yeah.
Okay.
Yeah, it was proposed, I think, originally as a statewide thing, and the governor did not sign that. And so he did agree, though, to sign this, where it's up to the individual municipalities to decide whether or not they needed it. And then it was legal to do so. Yeah.
All right. Good.
Well, thank you so much. We appreciate the information and look forward to having some more information and discussion about it.
Yeah, and I've got plenty of printouts of some different things here if you want me to leave them on the desk.
If you
or
will.
For you guys' information.
And she'll give them to us.
Okay. All right.
Okay. Thank you. Did anybody else have anything else on these 6 items on the agenda? Okay. If not, then over to you, Brian, on ordinances on second read.
Yes, sir, Mr. Vice Chair. We're under Ordinance 74. This amends the City of Shreveport, Louisiana's 2018 Special Revenue Fund budget, State Narcotics Fund, appropriating the funds authorized here, and this is to move $10,000 to the investigation of felony crimes for the State Narcotics Fund. Ordinance 75, we're going to ask to be tabled. This is authorizing and providing for an encroachment on a portion of city public dedication from Lot 15, Piermont Hills subdivision. Again, the administration will ask that that be tabled tomorrow. Ordinance 76 authorizes the mayor to execute a lease, a city-owned property located at 109 Spring Street, Shreveport, Louisiana, 71101 in Caddo Parish at 107 Spring Street, LLC for improvements to the subject of property, including creation of an additional downtown public parking for purposes which benefit the public. This is a 3-reader, so this will not actually be approved or adopted until October the 9th.
Okay. Are there any questions?
On 75,
Yes.
does the property owner
Yeah, there's a
know that?
there's a little bit of they contacted us either last week, and there's a little bit of issue of whose property it is, and so we need to work through that before we move forward. And so they brought that to our attention. We were ready to proceed, but they have some questions, and so I think it's appropriate that we table it until we have those questions answered,
No problem.
or at least postponed.
Okay. Anybody else? I'm gonna double back to ordinance 77. Why is that item on our agenda? Is it because it's greater than $5,000? Why are 77 and
We have to put the money in the capital budget to be able to purchase those items.
so it's at any threshold?
Any threshold. That's not a donation.
Yeah. Okay. I mean, I guess then I'd ask is what amount of money is causes it to be a capital project when it's a some would suggest that it's probably not very capital.
No,
But
I understand that.
so yes.
Yes, sir.
Okay.
Sure.
Tabled legislation. I am not aware of anything coming off the table. There may be a chance that Mr. Toms is available tomorrow in discussion with his staff on that, and I will send an email over to administration if he doesn't tend to be.
Okay.
He can make it. Okay. Property standards appeals.
We don't have any this month, or this meeting. The next two are postponed until October the 8th, which will be our next meeting, first in October.
Perfect. ABO appeals, there aren't any listed here. MPC appeals, none. No other appeals. Reports from officers, boards, and committees.
Mr. Chairman, I don't have a report, but I want to inform the council office that I will be scheduling a small emergency business task force meeting for October the 4th. October the 4th. Small emergency business task force. I'll email you. Okay. Okay. Thank you.
Okay. One other thing, just to say that did have a fruitful meeting. I don't know if the mayor mentioned this about the airports, but downtown airport, FAA, hopefully there's progress being made, and I think we're going to get some more feedback from the FAA this week, or at least that's where it seemed to be left. Maybe not. Okay. But at any rate,
We're hopeful.
we're hopeful. Okay. Clerk's report. I don't know if you need to go over this since most of this was already done in our meeting. Is there anything to add? Madam Clerk? Okay. Additional communications.
Chairman, I tried to push the button, but to make a couple of additional communications.
You would be on B. I am on A at the moment. Additional communications from the mayor.
From the mayor, okay.
She gets to go first in this part of the agenda.
Oh, this part of it.
We go first in the beginning part and last. Anything from the administration?
has none at this time.
Okay. Additional communications from council members.
Thank you.
Mr. Bradford, you're up.
Thank you, Mr. Vice Chair. In the spirit of transparency, which seemed to have been an issue over the last week and a half since we met last, are we clear on the issue that Kia Radio brought to our attention? Is anybody clear? Are we clear on that?
I mean, I'm clear in the sense somebody have sent me a signed contract dated March 5th where we clearly engaged Car Rigs and Ingram. I believe that came from either the administration or the council office also distributed.
Okay.
That shows the date of that contract and what's in the RFP. I mean, I don't know what else.
No,
The rest, I mean, but there is a definitive document that we've received that shows that it is.
Because they caught me off guard. I was, and I told them, listen, we are televised. They can look at the videos and find out if we are not. But I'm glad I hadn't seen that document, so I'm glad.
There are about 8 different attachments, and I think it's the last attachment.
Okay.
It was emailed to all the council.
So this morning?
No, last week.
Oh,
But there are a slew of attachments. It is I believe, at least on my version that I got, it was the last of the 8.
The
So if
actual
you didn't-
contract, it's all the way,
if
scroll
you-
down.
So you have to scroll down in your emails to
Okay.
get all 8
I
attachments. So
reviewed
you
it.
might not have seen it because of that reason.
Okay, good. And the other one, Mr. Crawford, and it may or may not, there have been several incidents of police shootings and other high crime, violent crime activities that has occurred. Is there anything that could be reported to the council by the chief of police regarding those incidents? Was it actually? I mean, I know some things are in investigation, but the evidence that was reported that police officers was to be ambushed, is that accurate?
I'm going to ask the chief to. Yeah, we don't have anything to report on it now, as it's still under investigation.
But
as soon as we have something available to you, we'll.
But that was the statement that was released. But you're not prepared to. That's not the statement.
I don't. Hang on, chief. Just tell them what you can, chief.
I can say this much. That probably the reason.
Chief, go to the mic.
The reason that terminology was probably used was because of what's depicted up on the officer's approach, how the 2 individuals split the officer. And so as far as making a full-fledged determination that is 100% their thought, we have not been able to do that, but their actions.
But the officer felt that that's what they was trying to do.
That's from, I cannot tell you where that originated from, whether it was in the course of the investigation from the investigators or how the officer felt, but that's where that came from. But as far as any complete validation of that, we have not determined that yet. It's just from the actions that's depicted on the video and, again, upon the officer's arrival. But as far as the communication between the officer and the lead investigators, I can't discuss that here.
I'm saying,
That's
no problem with that, Chief.
Yes, sir.
No, but again, and I mentioned in the spirit of transparency, oftentimes we get confronted with inquiries from the public on items that we're not up to speed on, or we have not been made abreast of.
Well, what I will say is that our officers responded relative to a call for service.
Sure.
Okay, and the call for service was two black males were walking down the street with a dog, firing shots in the air. Okay. And when the officer arrived on scene, that which was depicted by the caller is what the officer engaged. So it wasn't something that the officer initiated. That officer was responding to a call for service, and he just happened to be the first one on the scene, and that's what he encountered.
And I appreciate that, and we'll leave that there. But there were several other incidents of shootings. Can you give us any enlightenment on those? Where we are with those?
So you saying you talking about shootings in general?
Yes.
You mean between that officers are shooting or people shooting each other?
No. I'm talking about residents, citizens involved shootings.
Most of them are the same, short of domestic. We just had one today that's probably the result of the initiation of it appears to be domestic, where a gentleman kept going to a house up on Point Capay, and that gentleman was arrested, and then his brother showed up, and something caused the female to engage him, where shots were fired, and we just got the update that gentleman has died at the hospital. But the origination of it was a domestic issue, and unfortunately, a lot of those are that way, domestic. And then the other side of it is some type of felonious activity that many individuals are involved in, many times drug related, and they go back and forth with each other.
Whether it's either or, what you just mentioned, those are still offenses that the person should be arrested. Is that right?
Yes. Matter of fact, the lady is in custody, and if the circumstances bear out that what she did was justified, then the proper procedure will be followed there. But upon initial arrival, she was taken into custody, and sometimes if the evidence lead there, we do that. If not, such as the one that took place down in Ms. Councilman Fleury's district, that was information that could not corroborate or would not probable cause didn't exist for an arrest then, but upon further investigation, it found out that it did point back to the female that was in the house, and a warrant was secured and she was arrested. So it just depends upon the information at the time of arrival, and if enough could be gathered to make a probable cause arrest, or if there's not, we put it together to try to get send it through the district attorney's office to be reviewed and signed off by a judge to get a warrant for the proper charge.
And that's all I'm asking. That
yes, sir.
That regardless of how an incident happened, if somebody got shot by another person, if it could be ascertained, I mean, it doesn't even have to be. I'm not talking about prosecution. I'm talking about the policy or the criteria for arresting somebody for shooting somebody.
Yes.
That's almost automatic.
Yeah, if we have enough probable cause, an arrest to be made on the scene, then we will make it. If we have it, if not, then we try to gather the needed information to secure a warrant.
Okay.
Yes, sir.
Thank you, sir.
Yes, sir.
Thank you, Chief.
Yes, sir.
Any other comments from, Councilman Corbin, excuse me, you had already said you wanted to make a comment.
Thank you. Just a quick announcement. Tomorrow evening at 6 o'clock, there'll be a City Council District D candidate forum at Grace Community Church, 9400 Ellerby Road, and the 4 candidates are confirmed to be there. There'll be some prepared questions and probably, as time allows, a few questions from the audience. But that's 6 o'clock tomorrow night, Grace Community Church. Thank you, Mr. Vice Chair.
Thank you for that public service announcement. Anything else? If not, meeting is adjourned.